Hello there. Good evening. My name is Chris. I'll be your RN. I just want to follow up with the education with you on HIV. And specifically today, we just want to talk about the medications and the alternative medicine that can help support you um, with your new HIV diagnosis. Okay. So just a little bit of a recap what we talked about with HIV. Okay. And we always hear that abbreviation HIV. It actually stands for, if you ever wondered, human immunodeficiency virus. Okay. And this virus in the body, it attacks the body immune system, specifically a immune cell called CD4 cells. And that helps protect us from infection. So HIV is not treated. The immune system can become severely weakened and progress to a point called something called AIDS, the most advanced stage of the disease. Okay. But just good news on that one. That modern treatments allow people to with HIV to live long and fulfilling lives when they take their medications consistently. So that's exactly where we're at today in today's education. So we're hoping that we can have a good conversation about this. And what type of medications may be involved in treating HIV? Is it a lot? Is it gonna cause a lot of disruptions in my life? Well, we'll be talking about that. So the most important treatment of HIV is called antiretroviral therapy, or we call it an abbreviation ART. ART. Basically, the medication works by stopping the virus from multiplying in the body. Simple as that. Brings the virus count down lower. Okay. And when patients take ART regularly, the amount of virus in the blood becomes low, as we said. The immune system becomes stronger, risking the spread of HIV to loved ones, family members, and others. The transmission rate becomes much lower too, as well. See, when your immune system becomes stronger because of the viral load going down. So that's basically what the effect of the medication is. And say, oh, well, what medications are these? Well, there's about three mainstream ones. It's one is tenofovir, emetracibine, and dolutegravir. Okay, and you're like, well, is it very involved to take these meds? Well, actually, usually what the prescribed dosage, prescription for it is just one pill per day. That's it, one pill per day. Yeah, and when you take these medications exactly as prescribed, one pill per day, it's very important. Okay, then it leads to the viral load going down. Okay, but shouldn't miss any doses. Okay, when we prescribe this medication to you, because if we miss any doses, right, we said the viral load goes up, multiplies, or also may lead to drug resistance. Okay, and that makes a virus kind of supercharged, in which the medication that we usually give won't affect it as much. Yeah, and that could weaken your immune system, okay, making the treatment less effective. Right. So it's just one of those three medications or a combination of one pill a day to bring that viral load down. And that's basically what that medication does. You may be wondering, okay, well, what's going to be my quality of life? HIV/AIDS sounds like a very scary thing. Um, but, okay, it's important to kind of look around us that HIV does not prevent someone living from a full life. Okay. And we just might want to look at some famous people that you might know. Hey, I think you're into basketball. Well, I am too. One famous example is Magic Johnson. Okay, diagnosed with HIV. Guess how long ago? It's almost 30 years. 1991, he was diagnosed with HIV. But with the consistent treatment and healthy lifestyle habits, even with the HIV, treatment modalities all the way back then, he has been living with HIV for over 30 years. Okay, he's a businessman, philanthropy, public life, basketball star, lived a full life. And he just celebrated his 66th birthday not long ago, still alive and well because of the treatments that he's on. Okay, so that's just one example of the type of life that one could live even with HIV. It's not, mm, so to speak, something that would put you down and suppress you, but it's rather just something to be managed. Okay, so, but that's only because of the proper treatment, medical care, consistent therapy that he was doing, okay, with the medication, the healthy lifestyle that he was able to thrive and live normal lifespan. Well documented. It's not just Magic Johnson, but it's hundreds of thousands worldwide, millions, if I may say. Okay. You might want to, okay, what are some alternative support therapies for it too? Not just the medication, right? Medication helps. Yeah, that's the main streamline of how we treat it. But what are the things that support the body while going through it? Well, uh, patients benefit from. And it sounds like a very niche thing to say, but is living a balanced lifestyle, nutritious diet, physical activity, stress management, mental health counseling, support groups, okay, to lower the stress, herbal supplementation, alternative therapies. Some patients use that to support the body. Okay. They should never replace the HIV medications though, but all of those things support the body. Okay, because the viral load for HIV, okay, uh, oh, scratch that. I'm sorry. I'm thinking about something else. Okay. But before starting any, alternative medications or herbal supplementations, you definitely want to bring that up with your healthcare provider. All right. So those are some of the alternatives, or more so support therapies to the medication. But the medication is a very important thing to take. Okay, that's the main thing. There's no real documented way to manage HIV without those medications we mentioned. So it's very important to take those along with the adjunct supportive therapies. And kind of let's go over like when to seek medical care. Okay. Um, if you experience symptoms such as persistent fever, severe fatigue, unexplained weight loss, shortness of breath, frequent infection, okay, so these might indicate that the immune system is weakened or that treatment needs adjustment. So then we'll do some lab work, blood work, let's check your immune markers to see what that viral load is and what your immune system is doing. Okay, so that's just a brief overview of kind of the treatments and the things surrounding it when it comes to management of your HIV. So before we finish, I just want to make sure that if my explanation was clear, okay, I just want to ask you, um, perhaps if you can just tell me, just to kind of recap and make sure if I was understood clearly, because perhaps maybe sometimes I'm giving a lot of information, and a lot of this information is a lot that was given to you today, yesterday, and the follow up. So, can you tell me why it's important to take your HIV medication every day? Okay. Very nice. Yeah, that's exactly right. What symptoms would you make you contact your healthcare provider? Which you might have a suspicion that the medication is not reaching its therapeutic effect. Viral load is getting higher. Your immune system might be compromised. Okay. What symptoms would make you contact your healthcare provider? Very nice. Excellent. That's perfect. It sounds like my explanation was clear enough for you to let me know what I talked about. So, very good. Excellent. Now, if you have any questions at all, let me know. Anything that needs to be cleared up as far as the explanation? Oh, very nice. If there's no more questions, well, thank you so much for your time. The physician will come back in to reinforce some further teaching that he wanted to share with you. And we hope to see you soon in your follow up visit. Thank you.